Well, welcome to my home on Surfside Shores in Baldwin County. I'm so glad that you're going to be listening to our conversation today about COVID-19 or the coronavirus and how it impacts our community. I'm Dr. Richard Powers. I am a geriatric psychiatrist and a pathologist. I've done scientific research in my career. I also did public mental health, and in that capacity, I worked on the Katrina and BP oil spills and worked with Project Rebound, which most people still remember, that we put up during the last two disasters. So with that kind of background, I thought that we might have a little conversation about what's going on right now with regards to the COVID-19 pandemic. We all know that it's had a significant impact on our communities along the coast. And what we're trying to do is to provide you with the very best information to allow you to better understand what's going on and also make the very best decisions for your family and for yourself. Let's begin by talking about what is a virus. A virus is an infectious particle. It has genetic material as its core, and it is wrapped in a protein envelope. Coronavirus is one of a family of at least 7 viruses that the scientists have been working on over the last 2 decades. There are many other kinds of viruses as well. For instance, the HIV virus that causes AIDS, the norovirus that causes diarrhea and gastrointestinal problems on cruise ships, the herpes virus that causes cold sores. So there are many viruses that we have that we deal with on a regular basis. This virus replicates by attaching itself to a cell, say in the lung, and then it inserts itself into the cell, hijacks the genetic mechanisms within the cell, replicates itself, and then moves out into the rest of the body. And in doing that, it damages or kills that particular cell, like for instance the cell that lines the lung or the cell that lines the upper airway. The coronavirus is probably initially found in animals and may have jumped, perhaps from bats, to humans. The scientists are still working on that. Either way, though, we're pretty sure that it came from China, although that's not absolutely for sure. But what we do know now is that it's in the United States, regardless of how it got here, and we have to deal with it. How does it damage the human body? When it first landed in the United States and in Europe, we originally thought that it was a respiratory virus and caused pneumonia, which is an inflammation of the lungs. It turns out, however, that it's more complicated than that. And it turns out that the COVID-19 or the coronavirus can damage your heart, your liver, your kidneys. The one theme that seems to run through this story is that organs with a lot of blood vessels seem to be at risk for damage from this virus. We also know that the blood virus can cause clotting within blood vessels. Scientists are working on this very hard. At UAB, we're doing autopsies on individuals to try to better understand how the virus works. And so this is an evolving understanding of this virus. Just like it took us years to better understand how viruses like the norovirus or the AIDS virus worked. Eventually we figure it out, but sometimes it takes a while. How is it spread? Well, it can be spread in many different ways, but we're reasonably sure that respiratory pathways, meaning coughing, sneezing, or probably breathing heavily, such as occurs when people yell or sing may increase the likelihood of spreading. How dangerous is this virus? Well, the good news is that the majority of people who contract this virus do pretty well, especially if you're young and healthy. In fact, probably in excess of 80%. However, there's about 20%, and numbers vary by different studies, and that can be a little bit confusing, and I understand that, but as a minority of people have a lot of problems with the virus. Is there some way to predict who's going to have troubles? Well, not necessarily, but we do know that people who are obese, people who have heart disease or cardiovascular disease, people who have diabetes, or people who are immunologically suppressed, such as cancer patients, are at an increased risk for having difficulties from this infection. The even better news is that although this infection can be lethal, it's lethal in only a very small percentage of the patients. So why are we so afraid of it? Because it's really infectious, and it gets a whole lot of people. There were other coronaviruses that we had troubles with in the past. They're referred to as SARS and MERS. I won't get into all the details. They were probably more aggressive than the COVID-19 virus, but they didn't spread so quickly. It was harder to catch it, and that's why it was less of a problem. So the issue here isn't so much what's your risk for developing disease, as much as it is so many of us are going to get infected that the numbers of people who are going to be really sick is substantial. And that's what we saw happen in New York City. And as a doctor, as a physician who's taking care of patients, we always want to be able to take the very best care of our patients and give them everything we need and we know they need to survive. And what happens in situations where massive numbers of patients come to the hospital is that there's only so much assistance that we can provide. And that has been upsetting and perhaps demoralizing to some of our healthcare professionals. And so there are mental health consequences to this virus as well as medical consequences to the virus. And when we see all of these images of emergency rooms and ICUs being overrun by patients and doctors struggling, it alarms us as well. So it's easy to understand why, in addition to this being a medical challenge, it's also a psychological challenge. Okay, so this all seems really complicated, and it is. And you, like me, have to listen to the experts, because, for instance, I'm not an expert in infectious disease. I'm an expert in human disease, but I'm not an expert in infectious disease. And in fact, within medicine, there are people who spend their entire career, their entire life, studying these kinds of diseases. They're called infectious disease experts. And there's a lot of information out there on the internet, in the media. Sometimes you're not sure whether it's accurate or not. It can be kind of scary, some of the things that you hear and see. So who should you listen to? Well, listen to the experts. Alabama is blessed in that we have a very good public health officer, Dr. Scott Harris, and he is with the Alabama Department of Public Health. He is talking to all of the other experts within the state because the best minds at UAB and USA are working on this for both understanding the disease and developing treatments. He also talks to the CDC, the Centers for Disease Control, which is the best infectious disease center in the world. They are putting out guidelines and recommendations that help keep you and your family and your colleagues at work or the people that work for you safe and healthy. So we recommend that you listen to the public health officer, Dr. Scott Harris, and also you listen to the recommendations coming out of the CDC. The person who has probably done more on this than any other human being is a physician at the National Institute of Health called Dr. Anthony Fauci. His voice is always quite clear. And in addition to that, he has proven to be a leader because he is the man that whipped AIDS. And so we've got lots of experts that are going to help us and get us through this as quickly and safely as possible. So the next question is, why are we seeing a psychological impact, aftermath of all of this? And the answer is, first of all, the health consequences of this virus. And when I'm talking about the virus, I'm talking about the coronavirus, the COVID-19, can be pretty scary. We certainly know that the economic and social consequences have been pretty distressing. So it's easy to understand why people are distressed. The other reason that people are upset is because we don't have a specific, definite answer on how can I be sure whether I have it or not? How can I be sure that I'm immune to it if I've had it in the past? When is there going to be a treatment available to either prevent it, like I have with when people think that I have the flu, they put me on the medicine to prevent the flu from turning into a bad disease? When are we going to have a medicine like that? Or are we going to have better medications if I'm so sick I have to go to the hospital? And the answer is those things are coming. They are working on it, and believe me, I have in my 30 years career doing this, I have never seen so much energy and so many financial resources and so many bright minds in our country invested in trying to deal with this problem. I can tell you at my university, at UAB, our dean sends us a letter just about every day wanting to know what we're doing in the area of research and treatment to try to take better care of people in Alabama, and I am sure the same is going on at the University of South Alabama. The other thing is that all of the hospitals in the state of Alabama, under the leadership of Dr. Don Williamson, who used to be the public health officer, so he knows all about these things. Now he runs the Hospitals Association. They've all worked very hard to make our hospitals, our treatment centers, as safe as possible for you. So you can be reassured that the best minds in Alabama are devoted to making sure that we get the very best care and our hospitals are as safe as possible. So now that we've talked about what the virus is and why it's been so stressful, the next question is, well, what has been the psychological aftermath of that? And the American Psychological Association just recently released a survey. It's not a study. There's a difference between a study and a survey, and we'll talk about that a little later on. So it'll make you a more learned consumer of research. But right now, it was, in my opinion, it was a pretty good study. And what they found was anywhere between 2/3 and 3/4 of people in the United States today were having significant anxiety, worry about either themselves or their family member getting the virus. So as a country, we're kind of all worried about whether or not we're going to get this virus or not. Some other things that they're worried about. Individuals are concerned about managing their lives and also the education of their kids, because now most children are at home unless they were already being homeschooled, and the parents are now having to learn how to teach their kids at home and to juggle all of these responsibilities at the same time. The other thing that they've reported is that this social distancing, which unfortunately sometimes winds up making people feel isolated, has been hard on them. And finally, what they're worried about is access to health care. People are afraid to go to the hospital because they're afraid that it might expose them to a COVID-19, or are afraid to go to the doctor. And what we're seeing right now nationally is a decline in the basic health prevention strategies and interventions that we all depend on, like getting our vaccinations for other illnesses with our kids, or going in and having our cancer screening, or getting our blood pressure medications regulated. We've even noted, and it's recently been published in the literature, that the number of people who go to the hospital because they think they're having a heart attack may be declining somewhat. And that's not good. If you think that you're having a heart attack, you should go to the hospital or call your doctor. But don't just stay at home because you're afraid that you might contract COVID-19, the virus, by going to the hospital. So this disruption of the healthcare system has created some difficulties and additional health problems for individuals. But they're working on that right now. And I strongly encourage that if you're overdue for a blood sugar check, if you're overdue for a heart check, that you call your doctor. And I'm sure they can assure you that there is a safe and effective way for you to get in there and maintain your preventive care. The other thing that they discovered from all of this is if you're a parent, it seems to be more stressful on you than you're not a parent. No big surprise, but it's there. The other thing that they've looked at, based on this study, is they've asked people, well, how worried are you about either the economy or your job? And they compared 2019 survey to 2020 survey, and what they found was a significant increase in the number of people who were worried both about their job and about the economy in general. So the take-home message here is that the most recent information that we have about what's going on in the minds of all Americans, not just us on the coast, but all Americans, is that they're worried and that they're concerned. So, what can we conclude from all of this? First, these are difficult times. All of us, whether you're a doctor or whether you're running a business or whether you're in the food industry, all of us are experiencing stress and anxiety. And there are things that we can do to, first of all, recognize it within ourselves so we're understanding our own emotions and also diminish some of the stress that's associated with that. The second thing to keep in mind is that you need to respect but not fear the virus. Fearing the virus is not going to help. However, respecting it is a good thing. And the way you show respect for the virus and the consequences of the virus are listening to health officials like Dr. Harris or the directions that are coming out of the Alabama Department of Public Health and trying to implement them as much as you can in your everyday life to protect yourself and to protect your family. Recognize that everybody's experiencing stress. So for instance, if it seems like somebody in your office or somebody in the restaurant where you're working is inappropriately sharp or kind of grumpy, if you think about what they're going through, which is the same thing that you're going through, you can understand why sometimes people get a little bit irritable and grumpy and understand that it's not necessarily anything personal about you. Follow published guidelines. They're in the newspapers, they're on the television set with regards to using things like masks, washing your hands, keeping a certain distance from other individuals. It does help, it does protect. And finally, always remember that our coastal communities have been through a lot. We are a resilient community. We withstood Katrina, we withstood the BP oil spill, and we bounced right back better than ever. This will be a little bit of a rough road for probably anywhere for the next 6 to 12 months, but we will bounce back from that. There is every reason in the world to have hope. Why is that? Because the best minds, the best scientists, even scientists who never did anything in virology and studied viruses, they're all changing their direction. They're attacking this virus to try to do two things. First of all, develop ways that will prevent people from contracting it through things like vaccines and public health protection. And secondly, by affording you the best treatment if you do catch the virus, to make sure when you go to the hospital, you do well and you bounce back. So there is every reason in the world to have hope that, like all of these other disasters that we've moved through, that we'll move through this and bounce back better than ever.